17 newsmakers this morning. Dr. Hamel Cothry, the Chief Medical Officer for Dignity Health for the Central California Division, is joining us once again this morning on Sunrise. He's becoming a very familiar face here, and we definitely appreciate your insight, Dr. Cothry.
Absolutely. Thank you, Maddie.
All right, so let's talk about right now. We saw a surge in cases yesterday with 3 new positive tests. What does that mean? What does that, mean to you and in the community?
Well, I don't think it's something that's unexpected. I think we will see more cases show up as more testing results come back. We have over 200 tests that are still out that are pending resulting. So I still think we will see a rise in these cases of coronavirus.
We still hear so many people complaining, hey, I want a test, I need a test. They believe they need a test, but I can't get one.
So we are still being extremely strict on who we test. We do have strict criteria, especially in the outpatient world, and including the inpatient as well. So the outpatient, we have several labs. Quest Labs is doing it. PAL is starting to do it. Westpac, they're doing testing as well. And in the inpatient world, we at Dignity Health, we will hopefully start doing some testing next week for our in-house patients. And those tests will be great because we'll be able to turn those results around within 4 hours. Once Dignity starts, you should see more. The Adventist will start. Kern Medical will probably start as well. But we at Memorial Hospital will probably start next week.
Can you explain what we should expect to see happen because we're going to see so many more tests and so many more offices capable of doing these tests?
Well, I definitely think you'll see a rise in the amount of people getting tested. I think, right now we have stricter criteria. So I think those criteria may become a little bit leaner, and people will be getting more testing done.
Are we going to see a spike simply due to the fact that these tests are going to become a lot quicker?
I think, so one of the things we're hoping not to see a spike, but one of the things that the governor did last night that a lot of people don't like, which unfortunately I think is actually not a bad idea, is hopefully we'll see, we've talked about this flattening of the curve. I think we'll see more flattening of the curve, so hopefully less positive tests coming back.
So let's talk about any possible treatments. Is there any drug out there right now that you're looking at, and what can it do, and how fast could it get to patients who need it?
So we do have a study that we're looking at from Italy. It didn't have a lot of patients enrolled in it, and obviously it wasn't a long study, but we are looking at a drug, first line for mild cases. It's a medication called Plaquenil. We're using it for 5 days, and that seems to be to help reduce the viral load, which is the amount of virus in your body. The other thing we're doing is we're looking at maybe adding that with our common drug that everyone has heard about, the Z-Pak, putting the two together to see if those two can help reduce not only the viral load, but the Z-Pak will help reduce inflammation in the person. If
you're diagnosed with this next week, are you going to get these drugs?
It's going to be strict criteria to get these drugs because the pharmacies are already starting to run out. The president made a comment about this yesterday, and I think everyone's rushed to the pharmacy trying to pick those up.
And with all of the precautions that we're taking right now, the 6 feet, the staying at home if you can, how long does the virus last on surfaces? I think people are wondering and kind of confused about exactly how it spreads.
So this virus is a little funny virus. So there's data that shows, it can last up to 3 hours in the air. There's also some data that shows on hard surfaces it lasts up to 12 hours. But the funny thing about this bugger is it can last up to 24 hours in plastic. I don't know why it's chosen plastic, but plastic is plastic and copper. So I don't know why, but it's lasting a lot longer on those surfaces.
And I know this is really specific here, but what about cardboard? So many people are getting deliveries now because they don't want to leave their homes. They're getting, cardboard boxes delivered with their supplies.
Potentially up to 12 hours on cardboard as well.
Okay, so what's your recommendation if you're getting these deliveries to your home?
Ideally wipe it down.
Okay.
Or, if you handle the cardboard box, wash your hands right after.
Okay, so again, it just comes to these general precautions that we've been talking about. So what should you do if you come in contact with someone who has tested positive?
So we've dealt with this in the healthcare industry. We've actually had several people that we've actually suspected to come back positive, and they haven't in Kern County, but in some of our other markets, they have come back positive. The CDC has said, as long as you're symptom-free, you can continue to work. What we've told the medical staff is you wear a mask, and we take their temperatures at least twice a day to make sure that they don't have any temperatures. If you're asymptomatic, continue to work. If you develop symptoms, we go ahead and quarantine you, and when we test you as well.
So if you're positive, but you have no symptoms, I'm sorry, I just want to clarify one more time. continue to work if you're in an essential position such as the medical field or a first responder?
Absolutely. And the reason for that is, we already have a shortage of staff. We can't just close hospitals down. We can't quarantine everybody. We need hospitals currently. So the CDC has set out guidelines that we're following very strictly.
So another question, how are you dealing with this? How are our hospitals dealing? We've heard of things like mask shortages and glove shortages. We know you guys are working very long days right now.
So I'll tell you, I'll speak for Dignity Health. We are on calls multiple times a day, and one of the things we talk about is our masks and our gowns and gloves. We have decided at Dignity Health we're going to keep at least 3 days on hand. As of yesterday, the Public Health Department got some masks. We also have some outside vendors that have now reached out to us and given us masks. So I think in terms of masks, I think we will be doing just fine.
What about the capacity of our local hospitals? We've heard so much about the shortage of beds. If we see this virus continue to spread at the same rate and the shortage of ventilators that we could face.
So we've been planning for something like this for, a few weeks now. So if you drive by any of the Dignity hospitals, you'll see tents outside all 3 of our campuses. We have the capacity here at our local campuses. I've also reached out to Adventist Health, to Kern Medical, to Hart Hospital. They also have a surge plan in place. I believe we will not run out of beds in our community. I think we will be able to take care of each and every one of us that needs a hospital bed, including the ICU beds as well.
That is good to hear. We have a few viewer questions that we wanted to ask this morning. And this one is coming to us from Abby Dillon. She says, if younger people were to get the virus, even if they are, in this lower risk category we've been hearing about, could it still cause permanent lung damage or long-term health conditions?
We don't know the answer to that currently, being that this virus is so brand new. But what we are finding that we didn't know last week is that we used to believe last week that younger people would get a mild case of the disease. We are now seeing younger people get very sick, just like the old people over the age of 65. So unfortunately, this virus is not discriminating against age anymore.
Is that kind of across the board, or is it still more prevalent and more serious in our older population?
So it's definitely, we're seeing more in the 65 and older in the United States, but we have started to see young patients here in our country, but a lot more in Italy as well.
And then one more viewer question coming to us from Brenna Berrigan. She asks, should you practice social distancing with multiple children at home? I can't imagine how this would go.
I'm sure parents would like that. Unfortunately, I think it's almost impossible to do that at home. And that's, if we can confine the virus to the household, we're still better off than transmitting it to the other population.
All right, Dr. Hamill-Cothray, thank you so much for joining us this morning, the Chief Medical Officer with Dignity Health for the Central California Division. Dr. Cothray has been so generous with his time to agree to come in with us again next week and continue to answer these questions. So if you have viewer questions that you'd like to ask him, you can feel free to submit those to us on social media, and we will get those to him next week. Dr. Cothray, thank you for all you're doing for us.
Thank you.